Good afternoon, and thank you for joining us. I know that many of us are pretty tired and weary and bleary-eyed after a long night watching TV and the election results. But unfortunately, coronavirus doesn't take a break, and so neither do we, as we continue to fight this pandemic that just refuses to go away. Over the last few weeks, our county has been fortunate that our tremendous testing efforts and our overall response to this pandemic has kept us in the red tier, or the second tier on the state's reopening system. All along the way, though, we've been warning that our hold on that tier was very tenuous and that we needed to remember that the virus is still out there and that we couldn't relax our vigilance against it. Unfortunately, we're not looking good in our efforts to remain in the red tier. In fact, the trend in our numbers is that we're headed in the opposite direction and moving over towards the purple tier. Whether we get placed in that purple tier depends on each and every one of us. Our experts are crunching the numbers, and we'll be working with the state to avoid the purple tier if we possibly can. But the truth is that people are tired of this pandemic, and unfortunately they're letting down their guard. They're not wearing their masks, they're not maintaining the social distancing, and all the other things we've been talking about for these last 8 months. Frankly, we need to do better. We need to do a lot better, and we can do better. And to that end, I want you to know that we are expanding our robust testing efforts even further to test more people to prevent them from spreading the virus even further. As the holiday season gets closer, we know people want to spend more time together, especially indoors with their families. Again, we urge you to avoid large gatherings. But if you believe you've come in contact with someone with COVID-19, please get tested. This week we'll be opening up a new testing site in Imperial Beach in my district, which has been hard hit by the COVID-19 virus. This is replacing a site at Mar Vista High School. It's a very close by to Mar Vista High School. It's a walk-in testing site that will open Monday at the Imperial Beach Sports Park Recreation Center at 425 Imperial Beach Boulevard. The site will operate Monday through Friday from 8:30 a.m. to 3:30 p.m. We also have 2 more sites in the North County area coming online very soon, and we'll be having another site that Supervisor Fletcher will talk about in his comments. Dr. Wooten's going to get into more details about the purple tier and what it means for all of us, especially businesses and schools. With that, we'll move on to our updates from Supervisor Fletcher, followed by Dr. Wooten.
Thank you, Chairman Cox, and good afternoon. For the past several weeks, we have been sounding the alarm about the increase in cases that we've seen throughout San Diego County. And unfortunately, that increase in cases has caught up with us as it relates to the tier that we are in per the state guidance. In the month of October, our unadjusted case count went from 7 to 7.2 to 7.8. It's now gone to 8.7. And over the course of the last month to month and a half, our considerably higher than average testing has been able to provide an adjustment factor which has kept us in the red tier. But again, there are limitations on how much credit you can get and how much that can help when your case count continues to climb as ours has. And so the reality is this is our first week in the purple tier. It is worth noting and reinforcing that there is no change in public health orders or restrictions after 1 week in a tier. It takes 2 consecutive weeks in that tier before any of the limitations around indoor operations are reinstated. We certainly hope that we avoid that. We'll have to wait until next week to see what our numbers are next week. But it would take a significant change in trajectory given everything that we've been witnessing over the course of the last month in order for us to avoid that. But we remain hopeful and somewhat optimistic that will happen. But what we know is that we have it within our power as a region to control the spread. We see examples throughout America of what is possible. We see examples of what is possible if you don't work to slow the spread. You see significant taxing to your healthcare system. Right now, Missouri, Oklahoma, Iowa, Indiana, Nebraska, North Dakota, New Mexico are all reporting record high hospitalizations and significant strains on their healthcare system because they did not act soon enough to slow the spread before it led to significant challenges with their healthcare system. That is what the tiered system and that is what our actions strive to avoid. Sometimes you have to take action before you think it is necessary. On the flip side, we see what is possible even in urban areas that have significant densities. We've seen San Francisco County be able to descend into the lowest tier. Again, heavy population, heavy concentrations, but they have been able to do it. So we know what is possible if we truly commit ourselves. We also know what is possible if we don't take the appropriate action at the appropriate time. And so we will continue to work. Our testing folks will continue to do incredible work, leaders in the state in increasing testing, and we will continue to strive to reinforce with everyone out there the things that we need to do in order to slow the spread. In addition to increase in case count, I'll show you in the slides in a minute, a slight uptick in increase in our percentage of positivity and a slight uptick in our health equity metric. We need all of those numbers to be trending down. Once they trend down and we get in a comfortable level, then perhaps we could live with the plateau or a maintenance. But right now, the overall trends are not good for us, and that is what has precipitated us making the first week into the purple tier. But again, to reinforce, there's no change in restrictions or public health orders after 1 week in purple. It takes a second week, and we will not know that until this time next week. So we will continue to work to do everything. But our message, again, is clear. We have it within our power to slow the spread, lower the case counts. That not only fights to save lives, but that fights to help our economic recovery, and we certainly want to strive towards that end. I do want to mention, as Supervisor Cox mentioned, our T3 strategy, test, tracing, and treatment has been foundational and cornerstone to what we're doing. We are doing an incredible job at increasing our testing. We're going to continue to strive to do that. Today we're opening a new free walk-in, no appointment testing site in the city of Lemon Grove. This will be at the Lemon Grove Community Center, located at 3135 School Lane. It's open 7 days a week from 8:30 a.m. to 5:30 p.m. and has the capacity to do 500 tests per day. This site makes 56 total sites located throughout San Diego County that are available for anyone 6 months or older to get tested free of charge. And we are working very, very hard to ensure that testing is available for every San Diegan who would like to get a test. If you'd like more information on those, you can call 211 or visit their website, 211sandiego.org, or you can go and be linked to it from the county's website at coronavirus-sd.com. With that, let's jump into our weekly charts here. Again, you see our 7-day average of testing is incredibly strong, over 12,000 tests average per day. Percentage of positive up slightly there at 3%. Total tests we are pushing, and perhaps by tomorrow will be more than 1.5 million tests reported. Contact tracing, case investigation, and treatment efforts all remain very strong. Today we're reporting a new total of 404 positive cases. Again, this is only 3% percentage of positive as we advance to the next chart there. Oh, there you see testing turnaround times remain very strong. Again, that's an important component of testing. We'll go next to our cases. Yes, there you go, 404. Again, 3% percentage of positive. You see there the purple line, you see that trending upward. That is our percentage of positive on a 14-day period. That is a number we would like to see coming down. We had seen it come down previously. And again, we're seeing an increase in cases. And so that's having an impact on our percentage of positive, and it's having an impact on our tier. And so these are all numbers that we want to keep an eye on as we move forward. But there again, you see the totals for where we are now. Daily hospital census, you'll see an uptick here, and I just want to point out the asterisk that is there. Starting 10/31, COVID hospitalization census numbers, the federal government aligned. Previously, if you'd been in the hospital for COVID beyond 10 days, you weren't counted as a COVID patient. CDC and the federal government changed that, and so part of the increase that we've seen there is attributed to that change as it relates to COVID patients you see on the asterisk right there. But you see 106 in ICU, 297 overall. Next, we'll look at how our COVID hospitalizations are factoring in compared to overall hospitalizations. And again, you see total hospitalizations there at 4,378, below our 80% reserved cutoff list. And next, ICU utilization, again, still holding relatively stable even with that change in accounting, but it is up a bit at 68%. That concludes my section of the report. I'll now turn it over to Dr. Wooten for a public health officer's update. Dr. Wooten will also be walking through potential changes if, in fact, next week we have a second consecutive week in purple and we are sent into a higher tier.
Welcome, everyone, to today's briefing, and thank you so much, Supervisor Fletcher. So our local COVID-19 cases continue to increase, and as today, our count is 58,106 cases, which is 404 more cases than yesterday. And I'd just like to share with everyone that over this past week, we have had 300 or more cases, and we really want to see our daily case count be in the 200s or less. So we are counting on the public to practice these best practices strategies to help decrease these numbers. Now, the age range for our cases remains unchanged from 0 to 102 years of age. And the age group, 20 to 49 years of age, remains at 58%, which makes up the largest proportion of our total number of cases, from 20 to 49 years of age. 29,762, or 51% of our cases, are female. 28,193, or 49%, are male, and we have 154 individuals for which we have no gender information identified. 3,983, or 7% of all of our cases, have been hospitalized. 59% of the cases were in the Latinx population, and 921 of those that were hospitalized have been admitted to the ICU. Now, this number is approximately 2% of the total number of cases and 23% of the total number of those hospitalized. And the total number of cases also includes 904 deaths, which represents 1.6% of the total number of cases, and we have 3 new deaths that are reported today since yesterday. Now, of the 904 deaths, 862, or 95%, had an underlying medical condition, and the remaining 42, or 5%, had no underlying medical conditions. And the top 3 underlying medical conditions have not changed. These remain to be hypertension, diabetes, and heart disease. Now, in the next slide, we will review the triggers dashboard, and there are 2 metrics that are abnormal. I will first talk about community outbreaks, and then we'll talk about the adjusted case rate. Today, we are reporting 25 total community outbreaks for the past 7 days, from October 28th to November 3rd. Next slide. This represents a total of 102 cases. In the next slide, there were 7 additional outbreaks reported for yesterday, which includes the list that is here. 3 are in restaurants/bars, 2 in 2 different businesses, 1 in a grocery store, and 1 in the healthcare setting. Now, moving to the next metric, which is related to case rates. This is explained in the Blueprint for a Safer Economy, which is the tier framework that Supervisor Fletcher alluded to. And this has the metrics and thresholds that the state is holding each county to. Again, the system is based on the levels of disease transmission by first widespread, which is the purple tier, substantial, which is the red tier, moderate, orange tier, and minimal is the yellow tier. As of today, in the next slide, Wednesday, November 4th, San Diego County remains in Tier 2. We will not officially move to another tier without being in that tier for 2 weeks. So this week, our numbers reflect Tier 1 status, but we are still technically in Tier 2. So the county's COVID-19 unadjusted case rate for the week of October 18th through the 24th of October increased dramatically from 7.4 to 8.7 per 100,000 residents. So again, this is Tier 1 or purple tier status. The adjusted case rate is now 7.4, and it increased last week from 6.5, which was in the red tier. So with the adjustment, which is related to our testing rate, this places us still in the purple tier at 7.4. But we need to be in this status for 2 weeks before officially transitioning to that tier. The health equity positivity rate increased by 0.2 of a point from 5.1 to 5.3. And then based on the results just shared, specifically the case rate, San Diego County's data, as I stated, is technically in Tier 1 or the purple tier for this week, but we are still being maintained by the state in the red tier until we have a second purple tier status. If our case rate continues to increase for the second week, San Diego County would officially move to the purple tier with specific restrictions imposed. Now, if the trend continues, as you see in this slide, it means that there would be more restrictions of activities across various sectors. Currently, being in the red tier with more sectors open, but we would move into the purple tier if next week we also have the numbers that support that. And this would result in restrictions, as you see here on the right side of the slide. People would be asking to work from home, and outdoor dining, these are just two examples, would be imposed. So many of you might be curious, in addition to the examples I've just shown here, what else would happen if we moved to the purple tier? In the next slide, specifically, what this slide shows is on the right side, Tier 2 activities. So those activities would change to what you see on the left side of the slide that would be allowable under Tier 1 or the purple tier. So we would go from 50% indoor retail to 25% indoor retail, from 50% indoor and reduced capacity for food courts to 25% indoor at shopping centers with no food court utilization. And restaurants would go from 25% capacity indoors to outdoor capacity only, and that would be the same for places of worship, movie theaters. They would go from 25% to outdoor only. And then lastly, for K through 12, distance learning would be only allowed unless the schools had already opened. So if schools are already open for in-person instruction, that could continue. But no new schools could open for in-person learning. In this next slide, this basically gives you the full list of activities of what would be allowed in the purple tier if we did indeed move to Tier 1. Next slide. So, as I remind the public every week, the following simple preventive measures are evidence-based and have been proven to be successful to help slow the spread of COVID-19 until a vaccine is available. These include washing your hands and maintaining good hygiene, keeping 6 feet apart from others, wearing a facial covering, avoiding large crowds, groups, and parties. And really, it's important to stay home if you have symptoms. Now, I also want to say that we are commonly asked if there is a specific sector responsible for the increases in our number of cases. As stated previously, there are no specific groups that are responsible for our increased number of cases. COVID-19 is pervasive throughout the entire county, but I do want to call attention to two groups to share with you. Again, these are not the main cause, and actually make up a small, one of them makes up a small percentage. But I'd first like to just bring attention to the young adult population, ages 20 to 49 years of age. This population is not seen, and we get pictures and photos of individuals at parties not wearing their facial coverings and not social distancing. Also, the worksite was a source of potential exposure in this week's COVID-19 watch, with 29.6% increase in reported cases in this sector from September, with 1,997 cases, to October with 2,589 cases. And for employers, I want to bring attention to CDC's employee playbook. We have sent this out to employers through our employee or business sector in previous months, but we want to make sure that people revisit this, because it has great information to help prevent the spread of COVID-19 in the work site. So as I close, I would like to remind everyone that the state's assessment that places us in one tier or another is the result of, is not the result of the state's assessment, but it actually is the result of our individual actions and collective behaviors. That, and this is what assigns us to the various sectors. So only with your help can we implement the expressed preventive strategies to decrease the case rates and testing positivity to ensure that we stay in a less restrictive tier. So I would now like to re-invite back to the podium our Chairman Cox, so that we can take questions. Thank you.
Okay, we'll go to the first question.
Our first question is from Artie Ojeda with NBC7.
Dr. Wooten basically touched on it, but if there are any other thoughts that you have on it, I'm just basically what's driving the increase of these cases. And to that end, I'm wondering if you guys could give me an update on the status of those 8 cease and desist orders that were handed out over in the college area last week, if there were any cases in that area that drove up the numbers.
Okay, Dr. Wooten, you want to respond?
I think there were 2 questions from the information you asked, Artie. The first is there any specific entity that's driving things up? And as I stated in my comments, there's no specific entity, no specific sector. I called out 2 situations, the young adults not wearing facial coverings and not adhering to social distancing, and then I share with you what's happening in work sites. But none of those are the main factors. It really is across the board, because people are returning to their usual daily activities and probably not paying attention to those best practices. That is why we are seeing an increase in numbers. And I'll ask Gary Johnston to come to the mic to talk about the cease and desist orders.
Thank you, Dr. Wooten. Yes, our county's safe compliance reopening team did get some intelligence or some information concerning some possible large-scale gatherings at multiple universities. As a result of that, the county, by, with, and through other jurisdictions, to include the universities, drafted and served cease and desist orders to certain entities to try to get ahead of this and prevent these type of gatherings taking place and not have a repeat of what we had previously in the way of an outbreak. Those letters seem to do the trick. That, combined with some more surveillance by local law enforcement and other officials, those gatherings seem to not take place to the extent that we thought they would. And as a result, we feel that it was successful in what we had intended to do with the cease and desist orders. Would we expect to see some case increases over other activities during that period of time, the holiday time frame? We really won't know that for a while longer, at least for another week or so. That's just based on the standard factors with respect to case identification. So that answers that question. Thank you.
Thank you.
Okay, we'll go to the next question.
This next question is from Brandon Lewis with CBS 8.
Thank you. Good afternoon. I saw that San Diego County is adjudicating some of the data that CDPH is looking at. Could you tell us specifically what data is being adjudicated and how many cases are being adjudicated, please?
Okay. Dr. Wooten's going to respond.
I just want to clarify, probably several months ago, we submitted an adjudication intent specifically focused on our testing numbers. And that we have continuously worked on that, and we ensure that every week that we are getting credit for the correct test. Now, with us going potentially, with the numbers that were released today, which has us placed in the purple tier, we submit an intent for adjudication so that we can look at if there are factors, and we know that we have increased cases, and that is indeed the real reason why we are in purple. But we submitted that so that we can look at other factors that might be contributing and help reduce us from purple to red. So that's what we're doing.
So this is different than I think 2 weeks ago when we had the inmates that were incorrectly
Yes.
counted in terms
Yeah,
of
that specific adjudication appeal was resolved. So this is a whole, yeah, you're welcome. Thank you.
We have one last call-in question.
This question is from Paul Sisson with the San Diego Union Tribune.
Thank you. I wanted to dig in a little more on the adjudication issue first, and then I had another question as well. So you're saying that this week's request for adjudication is kind of pro forma, and there's no specific issue with not getting credit for testing or inmates being included. There's no specific issue that you've included in your request for adjudication this week. It's just kind of a general, we want to look at everything kind of request. I'm a little confused.
Okay, Dr. Wooten?
Well, Paul, we don't want you to be confused. Typically, when we submit an adjudication intent, if we are in purple, we are going to submit that intent, and then we will look, it gives us an opportunity, because if you don't submit it, you have no basis to make any argument. So we do that so that if there are issues that have contributed to our being assigned to purple, we can look at those issues and submit an adjudication packet to the state. So that just happened last night at 5:30 p.m. when we submitted this specific adjudication intent for our being in the purple tier. The previous adjudication intents or appeal requests was related to testing, and that was the last question that I just answered. It was as a result of specific tests that should not have been included in our total numbers of tests. We removed those because they were inmates, and that is the state's rule that they would not include federal or state inmate cases. Does that make things more clear for you?
I think so. Thank you. And I also wanted to ask about enforcement. You know, we saw a more aggressive stance, as you've noted, on Friday with the county getting out ahead and issuing cease and desist orders based on parties that hadn't happened yet. And now we have a situation where perhaps next week different businesses that are currently allowed to operate indoors, you know, I think over the space of like 3 days, having to move back outdoors again or shut down. You know, there have been a lot of public statements in the last month or so that a lot of businesses aren't really willing to do that, and they're maybe not to. And so I wonder, do you have an enforcement plan that would go business to business or something and force people to move back outdoors? How would that work if this did come to pass?
We would do exactly what we're doing now, Paul. We would work the process. And as we are made aware of issues, We address them, we conduct the investigation, just as we were made aware that these parties were happening potentially this past weekend, because we saw actual flyers. So as we become aware of situations, we will work the process and do our due diligence to educate and to give notice to ensure that businesses, sectors, restaurants are is following the guidelines. Thank you.
Thank you. So you would say basically that this would be kind of on a complaint basis with businesses that continue to operate indoors when they're no longer allowed to. If you've got a complaint, you would investigate.
Well, our compliance program is a complaint-based program, so we will continue with that process.
Thank you.
Dr. Wooten, this first text question is from Claire Tragesser with KPBS. She's asking about the tier assessment. You mentioned that other counties are improving in their tier assessment of the state. Why do you think other counties are improving and San Diego is not?
Well, actually, I didn't say that. You can see from the state's report on their website, it shows what counties are improving, and some counties are not improving. It might depend on various factors, the size of the county, the testing volume that the counties are performing. So it's multivariate. It could depend on many things.
Thank you, Dr. Wooten.
This last texted question that we have is dealing with the fact that as these numbers increase, are we going to be looking at more stricter enforcement? And Nathan Fletcher is going to respond to that question.
This one is from Laura Acevedo with ABC 10 News. Officials mention people are letting their guard down. Has the county considered any stronger enforcement methods to try and get the numbers down, like issuing fines or citations for people gathering, having parties, or not wearing masks?
Yeah, thank you for that question. The issue of enforcement's been an ongoing challenge all the way back to the very beginning of this, and we're certainly doing everything we can. So that we can try and stop potential super spreading events, so that we can try and have widespread enforcement. So we're going to continue to work with each of the 18 jurisdictions in San Diego County who have the enforcement authority in their jurisdiction. We'll continue to work with regional law enforcement leaders, and we also will continue to look at what our existing compliance-based teams might be able to do. As was just previously mentioned, we saw some success on some early interventions around cease and desist orders and public health orders, and there could be the potential for more of that in the future. Again, the aim is in no way to be punitive. The aim is that the entire county can benefit from lowering case counts and lowering spread, and that there's a level playing field for everyone in terms of following the public health orders. Again, it's what we have to do as a county to get our numbers down and to continue to advance. So we'll look for every opportunity and way we can do that.
Thank you, Supervisor. Well, obviously today was not a good news day in regards to COVID-19 in San Diego County. I don't think any of us look forward to being in the purple tier. Obviously, our ability to stay out of that purple tier on a permanent basis is going to be predicated on everybody doing what we've been talking about here for the last 8.5 months, wearing facial coverings, maintaining social distancing, and avoiding large gatherings. We certainly hope that we can work together in a cooperative vein throughout San Diego County to maintain the red status that we're in right now. Well, we're not in technically, but if we don't clear it next week, we will be in the purple tier, and I think that's something that we all want to avoid. With that, I would just say before we conclude that we will be meeting next week for the media briefing on Tuesday due to the Wednesday Veterans Day holiday. So we'll be back here at 2:30 on Tuesday, hopefully with some better news. Thank you very much for your participation.